Hi there, this is Mark Idelman, speech-language pathologist, and welcome to the Teaching of Talking. It's a beautiful day out here in Las Vegas. It's nice and cool. And this particular video is going to be about an upcoming Aphasia Seminar in Las Vegas in March. It's going to be March 24th, 25th, and 26th. And, there are many of you out there, and I read the posts all over the internet of people who have fathers or mothers who've developed aphasia, who had a stroke, who had aphasia, and they don't really know what to do. They often get speech therapy for their loved one, but the therapy often gets terminated very soon, and they're left not really knowing what to do. And that not only happens with the children of those with aphasia, but it also happens with spouses of those with aphasia who one day have a vital, communicative husband, and the next minute that husband has a stroke, has aphasia, isn't talking, is angry, is depressed, is anxious, and frustrated. And that's kind of the story of aphasia for many people. Not for all of them, but for many, because the services in America and the services worldwide really do not really satisfy the needs of those with a severe to profound aphasia who lose their ability to speak. And these countries and the healthcare delivery system just cannot afford to provide individualized therapy to those with aphasia for a year or 2 years or 3 years or 4 years or 5 years. Because what is it that we know about aphasia? Well, we know that it's not a problem that is quickly rectified. Now, a lot of people think that it is, but it really isn't. It takes a lot of work, and it takes a lot of work with talking, because you're dealing with a brain that was affected by a clot or a hemorrhage, and a different part of the brain has to take over or help out. And usually that part of the brain wasn't really designed for the purpose of speech. And so therefore it takes that part of the brain a lot of extra effort and a lot of extra work to contribute to the understanding and the expression of speech and language. So one of the things that is really present is the confusion and the lack of information, in addition to viable and successful speech therapy methods that can be used with people who have aphasia. And what happens is that there are some very good programs around the United States and around the world, but there are also a lot of programs that are not, and that are using antiquated methods, cookie cutter methods, worksheets, iPads, and alternate communication devices that are frequently given right away to people, and then they're expected to learn how to use the darn things and then apply them. Well, what happens is that a lot of money is spent on them, and quite often these devices stay in a closet. Now, iPads, worksheets, now those are good. Those are good for language, but they're not good for talking, because you can't talk to them. Now, if you're going to talk, you got to have somebody to talk to, okay? People are of the mistaken belief that you can improve your talking and improve your interaction with others without having the ability to sit down with somebody else. And that's what needs to be done from the very get-go, from the very start. That people who lose their ability to talk need to sit down with other people who have the ability to talk, and they have to engage in a conversation in a way that will be successful for the person with aphasia, and that's what the teaching of talking does. Now, so I said at the beginning of this particular video that we're having a seminar in March in Las Vegas, and it's the 24th, 25th, and 26th. And you can come with your partner, and you can learn how to stimulate speech and language. We can teach you that. You can come and stay for 3 days, and for 3 days, you're going to learn all about aphasia. You're going to learn all about how to test for aphasia. You're going to learn all about how to interpret those tests for aphasia, and these are very simple conversational tests. Then you're going to learn how to take that information that you've obtained from testing the person with aphasia, and you're going to be able to learn how to determine, well, how many words should I stimulate? Should I stimulate one word? Should I stimulate a sentence? Should I stimulate a phrase? Because a lot of people don't know just exactly what to stimulate. And if they don't know what to stimulate, what happens is it becomes a very frustrating experience for the person with aphasia. And then if an experience is frustrating for an individual with aphasia, well, that person frequently doesn't want to engage in the stimulation of speech and language and will refuse. And a lot of people wonder, why is the person with aphasia refusing? Well, quite often it's because their toes are stepped on. They're given methods of talking by a person that's not familiar with the right approach to helping people talk. And so if you use the wrong approach to anything, it's not going to work. It's not going to come out right. So we're inviting you to Las Vegas. You can come for 3 days, and we're going to intensively teach you how to stimulate speech and language. Intensively. And we're going to give you lots of practice working with your loved one who's got aphasia. And if you don't have aphasia, come anyway, and we'll teach you what you need to know, and we'll figure out a way for you to get the kind of stimulation that you need. So that's one thing. Now, what we also know is that some people just can't come to a place like Las Vegas. Either they have physical limitations or other types of limitations. So what we do is we also have speech therapy mentoring online, where you can speak with me and I can teach a caregiver or a son or a daughter exactly what to do to help their loved one with aphasia. So if you have aphasia, you can get expert help. My name is Mark Edelman. I've been a speech-language pathologist for 46 years. I've written a book called The Teaching of Talking, which is designed for caregivers and speech therapists to help teach them what they need to do to help people talk. Now, we're just completing now a new book called The Teaching of Talking, Apraxia, and that addresses the motor speech difficulty of those with apraxia. They have difficulty moving their tongue, moving their lips, moving their tongue and teeth and tongue and throat so that they can make clear speech sounds. So we have a book on that, and we're going to be developing that into a video course. And of course, we advertised for the Apraxia course that we're having in Las Vegas in early February. But this course in aphasia is March 24th, 25th, and 26th, and we hope you'll join us. Down below, you'll find our email address, you'll find our website, you'll find a information link that will tell you all about the aphasia course, and there will also be a questionnaire down below. So if you'd like to get personal mentoring, you can fill out that questionnaire and send it along to me. So we hope you have a great day today and a great week ahead. And if you're a loved one of aphasia, I hope that you'll dedicate yourself and make the investment of your time into learning how to help your loved one, because those who make the best progress not only have a great therapist, not only have a great method to use, but they also have a great care partner or a loved one at home who helps them talk throughout the day and who has learned what they need to do to help them talk. So this is Mark Ittleman. Have a great day, and we'll see you soon. Bye-bye now.